This is the case of a 58-year-old patient who rapidly developed progressive paraparesis associated with double incontinence. On an MRI of the spine, it was seen that he had significant edema at the conus associated with flow voids within the spinal canal. The patient was in the supine position under general anesthesia with electrodes for SSEPs and motor evoked potentials. A 6-French sheath was placed on the right femoral artery, and a Cobra 2 catheter is navigated from the groin to the fistula's point. We perform a complete spinal angiogram until the point where we identify the fistula coming from the L1. This is an AP projection where the Cobra 2 catheter was used to perform the injection all the way to the L1 radicular artery on the left side. This shows a typical case of a dorsal arteriovenous fistula with significant venous tortuosity inside the spinal canal. This is an unobstructed view of an Echelon 10 microcatheter navigated within the Cobra 2 catheter. We have a synchro wire that helps navigating the Echelon catheter from the arterial feeder through the fistula into the venous pouch. After flushing the catheter with saline and after that with DMSO, Onyx 18 is injected directly into the fistula. The goal was to occlude the fistula point and in a retrograde fashion deploy Onyx within the arterial system. Onyx is deployed, obtaining excellent penetration into the proximal connecting vein. At this point, an angiogram was performed from the guide catheter, showing no evidence of early venous drainage. The microcatheter was removed without complications. There were no changes during neurophysiological monitoring. The patient is able to be discharged from the hospital ambulatory. One day after the embolization, the patient is ambulatory in the intensive care unit and is transferred to a rehab facility for further rehabilitation. 6 weeks post-video, patient was discharged from rehab, still requiring self-catheterization walking out of the rehab. At 14 months, he continues to improve, does not require catheterization, he voids spontaneously, and he improved his sacral sensation. At 41 months, he's stable clinically. The MRI does not show any evidence of flow voids in the spinal canal.